The session is now being recorded and it will be posted to the IPHA YouTube channel later this month. Before we get started, just a quick housekeeping item. Your microphone should be muted during the presentation to just help keep some bandwidth and make sure everybody can hear the presenter. You can put your questions in the chat or Q&A features here on Zoom, and then there'll be plenty of time later on if you want to unmute, turn your camera on, whatever you'd like, and we can have plenty of Q&A. Today, our speaker is Dr. Welk from Iowa State University, and he's going to talk to us about their U-Turn program, which matches students with public health professionals. So I'll let Dr. Welk introduce himself and share about this opportunity with us all. Greg?
All right, great. I'm going to share my screen here, Brett. Let me pull it up here really quick. All right, hopefully everyone sees the, whoops, that's the end of the presentation. How did that happen? We'll try that. So does everyone see the start screen? All right, so yeah, thanks, Brett, for the introduction. So I'm a professor in kinesiology at Iowa State University, and anyone that knows me knows that I'm very passionate about public health, almost to a fault, I'd say. That's just my thing. So within kinesiology, many people might not know, but there's different disciplines. There's, say, exercise psychology, or biomechanics, physiology, motor control. There's all these different disciplines. My discipline is really physical activity and public health. So I try to study, how do we translate evidence-based programs into practice, and how do we get people to be active? If we know it's good for them, how do we get them to be active? But as part of that journey with my role in public health, I've developed a strong interest in translational research and implementation science methods. And so I'll share with you a hub that we've created on campus. I kind of led the development of this, called U-Turn. And we kind of enjoy the fun acronym there because it stands for University Translational Research Network, but also the name U-Turn kind of implies a change of how we do things, or turning around and trying something different, or trying something that really impacts the community. And so we've tried to adhere to that, and we've had a pretty good group of core faculty that have continued to lead this. It was funded through a campus interdisciplinary grant program. And so we had this 5 or 6 years ago, but now we're continuing to do it. And I'll share a little bit about how we try to advance public health through this translational model. So my work is, again, on physical activity. So I'll share with you a little bit about the notion of our Walk with Ease program. And then, as Brett said, if we have time at the end, I'll also talk about the student side of things. So first, I wanted to share a little bit about implementation science and the translational research model. Some of you might be familiar with that, but our interest is less about testing whether an intervention works and more about how it works and how to make it work better. So we always keep studying, how do we make that system work better and how can we sustain it? And sustainability is the other key goal. So anything we do, we want to anchor it to how do we sustain that impact, or how do we build capacity in systems to get it to sustain. So I'm very excited about the IPHA conference and the Public Health 3.0 and collaboration, and that all fits perfectly with what we try to do through our U-Turn network. So that's the website if anyone wants to go there. This is our model, and our vision was to enable healthy lives by empowering communities to take action informed by science. And when we use the word community, we don't mean necessarily a town, although it could be. It could also be a school, a work site, a county, it could be a church. So communities can be defined very broadly. And so our notion is that our research team works with community stakeholders to develop or to apply evidence-based programs into practice. So to try to take research to drive science-driven practice with the goal that we're enhancing that community system capacity to then sustain that community health impact. So anything we do, again, we're trying to build the system to sustain itself so that we can have a bigger impact. So I'll give you some examples, but this is our website, and within various teams and projects, we have a number of different colleagues that collaborate, and we do work in a lot of different settings and in behaviors. And so it's a very open, flat network. But one of our goals is, again, to facilitate the translation of evidence-based programs into practice in an array of settings. And I'm going to choose to focus on intervention we're doing called Walk with Ease. That's just an example, and I think it illustrates some things that research and public health can do together. But as we started building the partnership for our project, we started working closely with a group called CHP Community, which I'm sure many of you may have heard of or might already be involved with. But I've worked closely with Trina Radsky-Suchan, who's really passionate about building this network, and she's taken this to a really great level. But we worked with her for the last 4 years to kind of help get there. And so as part of this development of the hub, she did this in partnership with our Translational Research Network. And that's a really mutually beneficial partnership, because we need the hub to do our work and to have it scale, but she also needs the science to study how do we make these programs work more effectively and how do we make them work better. So this is one of the visions that we had with the hub early on, that we work to build partnerships for clinical referrals into community-based agencies and try to how do we make that work. So healthcare's providers might treat people or find people that have prediabetes, diabetes, arthritis. They might be at risk for falls. They might have hypertension. They might have obesity. So the goal is that if there's evidence-based programs, they could refer to those programs through the hub, and the hub would do all the work. The hub would help identify the appropriate programs that a person might need. So these would be the diabetes prevention program, for example, or in this case, Walk with Ease, which we've highlighted here. And so this is just a conceptual depiction of kind of how the hub is envisioned, that it would be a referral source or a way to refer clinicians to get patients into a hub, to get them into evidence-based programs. And we've continued to build on that model. So Walk with Ease, this is an example of what of a page on our website. So you see these are some other workforce development projects that have going on through U-Turn. I lead this other program called Switch, which is trying to build capacity in schools to do school wellness programming. And so now Walk with Ease is sort of at the totally other end of the spectrum, trying to build systems to promote healthy physical activity in older adults, Walk with Ease. So I'll give you a little bit of how Walk with Ease works. So it's broadly endorsed by the CDC as a lifestyle management program. So if you were on the CDC website, you would see that they have it categorized here, and with documented evidence that it aims to improve balance and strength, reduce or improve arthritis symptoms, improve strength, walking pace. So it's designed for older adults as a general lifestyle management program. And we work with these 3 national partners. So the Arthritis Foundation is who developed the original Walk with Ease program. They work in partnership with the National Association of Chronic Disease Directors, who kind of are interested in a standardized way to deliver this across states, and also in partnership with the Osteoarthritis Action Alliance, who have built a really robust online portal to deliver Walk with Ease. So this is really a triumvirate between these 3 organizations, and our team in partnership with CHP Community is the state hub for Walk with Ease. And so I'll walk through that a little bit more, because again, I think has a lot of potential for impacting the state as a whole here in Iowa, and I'd welcome any and all help in referring and insights about it. But the Walk with Ease program is a 6-week program. There's a guidebook and an online portal. So this book is available even on Amazon, and the participants can just buy the book and have a benefit. But the portal gives like weekly tips and reminders and accountability and ability to track their activity and instructions on safely walking. But it's supplemented with coordinated programs. So we actually deliver programming in 3 different formats: an in-person program that happens kind of in a group setting with older adults coming together, walking 3 times a week for 6 weeks in conjunction with the book. Or there's the self-directed version where they get access to the portal and they get assigned a health coach. So the standard model is just to do the portal, but our research has developed a nice health coach model where we provide a student trained in motivational interviewing to supplement that program and then enhance the outcomes. So that's another example of how we make it work better. We've also developed a worksite version where we deploy it more for younger audiences that, just to get in the habit of regular walking, and it fits within standard worksite wellness programs. So this is a picture of the website. So it's just walkwiththese.isu.org, or you can email our team here. And right now our project's open for anyone 60 and older, and they could refer to our local program or to the state as a whole. And we'd welcome any and all help on referring people into the program. But I'm going to focus more on like how the clinical partnership works, because I think that's what might be of most interest. So this is a page where people can sign up. So we have like a QR code, or they click a big red button, and it's really easy for participants to sign up. There's kind of a built-in screener, and so we've tried to make it easy for them to sign up for either in-person or virtual. There's other contact information, and this could be provided later, or people can just find me and I'll get the information to them, but it's just walkwiththese@iastate.edu is our email, or here's my email here. But the big step we were able to take this fall is we just got funded by the CDC to study the effectiveness of the Walk with Ease as a fall prevention program. So that's a high priority everywhere, but especially in Iowa, there's a really strong fall prevention coalition that Trina leads through the hub. And so they've, many people are familiar with like Tai Chi or Matter of Balance as evidence-based fall prevention programs. But the notion here is that walking provides a lot of other benefits for older adults, and it may have benefits for coordinated fall prevention. So the study is going to look at the effectiveness of PT prescribed exercise when it could be included within a Walk with Ease program compared to the base version of Walk with Ease, which is already pretty good. So this is an example of our flyer, and we'll be running this locally for the controlled randomized trial. But our real vision after this is to scale this again through the hub. And so we'd want to train other YMCAs or extension offices or public health departments or area agencies on aging to deliver the program in a standardized way across the state. And we've already been doing this a little bit with some of the AAA offices. We just finished a program in Johnston where they delivered the same exact program that we delivered, and we had the same outcomes. And so that was a good test case, but we'd love to work towards a model where we can train other communities to offer the same program. And I'll walk you through a little bit how we think that could work. So the original concepts for clinical referrals would look something like this, that CHP would manage this hub in partnership with U-Turn, and clinicians, again, could refer patients into the hub to evidence-based programs like Walk with Ease. But our real goal is not just a one-directional referral pathway, because the doctors want to know what happens to the outcomes, and they need this information actually to track that they've actually helped their patients improve their health. And so I think that builds into their ability to document that they've had an impact and with reimbursements. So clinicians would, this is how they refer, but our real model would be a bidirectional process where after a person finishes a program like Walk with Ease, the data would come back to the hub and get shared back with the clinician. Obviously, this would be done with the patient's permission through HIPAA compliance, but the patient could agree to let their data be shared through the hub to their clinician, so that when a person finishes Walk with Ease or a DPP program, the data comes back to them to inform their follow-up care. And this is a grand vision. I'm sure it's not new to any of you, but it's still really hard to operationalize. And Trina's done a great job of like figuring out how this happens. And so I wanted to share some broad strokes here, broad visions that she's shared with us through the hub about how this would work. And this is just to get some discussion going, and I'd love to hear people's questions or comments or experience with this. So the title of her session here was Building Bridges Between Disconnected Systems. So I'm just sharing her slides really. But she introduced the group to the notion of HIEs and SHIEs. So these are what healthcare agencies use to track and support healthcare providers' care coordination. So these are systems like Unite Us or Find Help, those types of organizations that clinicians use to track their participants. But community organizations also use their own system called CIEs, Community Information Exchanges. And these would help them manage their programs. So like AAAs have their own programs, or other agencies have their own. And so one of the challenges in public health, I think, is that these two systems don't really talk to each other. So this is depicted here with the doctor over here and clinic or community partners over here doing great things. So the vision would be, how do we get these two systems to interact with each other so that doctors can refer to evidence-based programs, and evidence-based programs can get good referrals and funding to support their work. So that's a little bit about depicted here. So these two independent circles are kind of what already is in place, and the real goal would be to get them to be harmonized together through a hub. And so that's what's depicted here, is that again, a clinician would be able to refer directly into a hub that would talk to the community-based organization. Individuals could still opt into a program, or other partners can refer into the program, but after a person engages, that information could still make it back to the doctor. And so our version of this that we're testing in our project is actually built right on this model. And we just finished a call with our research team about an hour ago to continue to talk through this. But in our model, we're working with McFarland Clinic and Mary Greeley Medical Center here in Ames and Story County. and they would be referring patients that are eligible for Walk with Ease into this hub. The hub would then refer to our team as an evidence-based or as a community-based organization, as a CBO. So we're going to be studying the system as if we're a community-based organization, because we want to maintain the kind of ecological validity of that scenario where we're learning about how a community-based organization would deliver it. So it's not going to be delivered by researchers. It's going to be delivered by trained community leaders that we work through, so that anything we do could be scaled back to a state level model. And so in this case, our Walk with Ease will be done also in partnership with Extension, and I've shown the I4A logo here because the AAAs are one of our major partners in trying to get that to be disseminated. So again, that's the vision of the program, but our full depiction of the Walk with Ease implementation model is shown here, and I'll just flash through this kind of quickly. But you're all familiar with Epic and electronic medical records, where a doctor might refer, and they use this system to track. So in our model, the Epic system would be linked through CHP Community to a tool called Workshop Wizard that would manage the enrollment and handle approvals and handle the tracking of participants. And it's, if people haven't heard of that system before, it's a common model used in many states across the country for evidence-based programs like Walk with Ease. And then this Workshop Wizard is also directly linked to the Osteoarthritis Action Alliance portal I referenced, so that's here. And so the Workshop Wizard can actually directly enroll them in the portal, and a person can enroll in the self-directed program or in a group program through that process. That activation would then trigger our involvement as the community-based organization. We would then deliver the Walk with Ease intervention either locally or through our state hub, through the virtual program to improve walking, balance, strength, flexibility. And then the notion of the bidirectional feedback would allow that as soon as that program's completed, the data would move through this system back to Workshop Wizard and back to the clinician. So that closes the loop on, how do we get that information from evidence-based programs into practice and have it refer back to doctor's care. So I wanted to keep that part of the presentation kind of short. I do have more to share if we have time to discuss kind of the community engagement work that we do through GivePulse, but I thought I'd stop there and maybe let people chime in for questions or see where that gets us.
If there are any questions, go ahead and unmute, or you can throw it in the chat, whatever works best for you. And if there aren't any questions right now, we could go ahead and talk about GivePulse.
Sure.
Tell us about that tool if you like.
Yeah, it's a different transition, but I can do that here. So what I think when Brett introduced this, he referenced our role of getting students involved, and actually the students are central to Walk with Ease as well. So we train them through a practicum course on adult fitness assessment, and then I also train them through a higher level course on motivational interviewing. So all the students that work with the Walk with Ease program are trained through our system. So one of my passions is to integrate teaching with research and service, and Walk with Ease is an example of this, and this is another. So again, this is where my passions lie. But for 5 or 6 years, we've been building kind of experience with a tool called GivePulse, and it's also a very powerful tool that we've managed under our U-turn umbrella here, because community engagement is one of our 4 teams. So to do implementation science, we need engagement with community partners. One way to do community engagement is to provide tools that are valuable to community partners. And so this other subgroup that I lead called Community Connections for Public Health is one example. And the reason I'm sharing these slides is Sharon created a team of people within IPHA that also have an interest in service learning. And I gave this talk to a group there, and I thought, well, maybe the same content would be of interest to people on this call. So I'll just walk through what GivePulse is and kind of explain it a little bit. But GivePulse is basically a volunteer portal that enables people wanting volunteers to find volunteers, and for volunteers to find programs. So it's kind of a matchmaking tool. There's many type tools like this that we use, and I guess I draw a parallel that it's designed for campus use primarily. So GivePulse can be used anywhere, but it really is ideal for a campus. So it's developed at the University of Texas by leaders there, and it's used by many campuses across the country because it's really aligned with academic needs as well as community needs. So it's a volunteer portal that lets you promote events and attract volunteers. It's a community event management system that lets you post and track events, track data, and it can allow users to track and monitor their impact. So students often want to document the number of volunteer hours they have or their service learning on graduate applications, and GivePulse gives a way to verify hours. So instead of them just saying that they volunteered, they can actually track impacts. And organizations can track impacts, and I'll show you some examples. So this is a program I lead in our department called Exercises Medicine. So this would be kind of the website for Exercises Medicine, and we offer kind of a range of programs such as exercise time or bingo size. So one is for kids and this bingo size is for older adults, but we often need to have volunteers sign up to staff these programs. So this is an example of the GivePulse page that would show like what's involved. And so GivePulse would be, this is a way that a person could find out about how to sign up for GivePulse or how to get involved in exercise. And so this would be a specific event within our page. And somebody could say there's a chance to sign up, and they would just click register for that program with the big green button. And when they do, if they track their hours, they would get a certificate of total number of verified hours, and they could track their monthly impact, total hours served, or hours served per month. And then this shows up on a URL, their own personal web page. So they can include it on their resume and things like that. So this is what a student would see probably when they volunteer. But I'll share a little bit more about our growth of GivePulse. So it's really taken off on campus. So, this is about when we were kicking it off, and we had up to 4,000 people enrolled before COVID. And then we've kind of lost track of our ability to track those numbers since. And some of our programming obviously was curtailed a little bit during COVID, but it actually proved to be a powerful way to support communities during COVID. We just didn't have the ability to keep tracking student involvement during those times. But this shows the total number of students that were enrolled. So 4,000 out of our 30,000 students at least had logged in and used GivePulse at some level. And this shows the accumulated tracking of impacts and hours over time. But the way the hub is designed to work is sort of in parallel with ISU's land grant mission of kind of reaching across the state. So as a hub, it can provide a hub for student organizations. So student registered clubs can have their own account, student groups can have their own account, like our Exercises Medicine over here. And all of these groups can have their own management of the platform, but all the data for these clubs gets linked to this hub, which gets linked to student organizations. Similarly, colleges can have their own page, but then each department each department within a college can have their own page. This is just showing an example for human sciences that would then lead to different departments like the Department of Kinesiology or the many different departments of engineering. So you can keep spreading the hierarchy out, but all the data keeps loading up to the higher level. And similarly with extension works in a county system. So each county can have their own website or page, and we can help them distribute that. And once they have access, they can spread it to their community, and every community can have a page and every organization can have a page. And so we've done this with several counties. Cerro Gordo is probably our most prominent. So Elise DeVries, one of the county health leaders in Cerro Gordo, has been really passionate about using that. And she's been using it as an example, but it's available to any county in the state. And so I'll show you a couple of visualizations. This is how, like, all the way that you can visualize the number of partners that are using the system on a campus. This is a heat map that shows just one view of where we're having an impact, where the biggest impacts are. So mostly on campus in Ames, and this is just one sample at one point in time. This is another depiction of how we envision it possibly working at the state level. So if each county had a page, that can link and support county health people, but it also can be a hub to connect extension and outreach, who each can have their own page. The county health departments can connect to each other and affiliate with each other and share programs, share events, share individuals or work. And so the green would be a network of county health leaders, and the orange here or red, whatever you want to call that color, burnt orange, would be extension and outreach, and they can connect to each other. But one of my passions has been to try to figure out how do we get county health and extension and outreach to connect. it exists in some counties, but less so in others. And so that's been one of my passions of figuring out how do we build a system that lets people connect and work together. And so this is an example of how that could work through extension that, again, these counties would support different programs. And again, 4-H might have connections with between each other, but they would also have connections with their own county, which would link back to the extension department. So this is how GivePulse kind of works, and anyone can get an account. So within our GivePulse page, it's easy for somebody to sign up, get access to GivePulse, and we would be able to create a base page, and then other groups would be able to use it.
Looks like Deborah raised her hand. Can we
Okay,
pause
sure.
real quick? Do you have a question, Deborah?
I really meant to clap. I think that is excellent. So thank you for recognizing me. But yeah, great job, great vision. And that connection is so important. Keep it up and keep us informed.
Well, yep, thank you. So I thought it's relevant for this topic here. It fits with this model of public health 3.0, right? That we can't do it alone. And so the counties all learn to work together, but this is a tool that is available to anyone to find and manage volunteers. So within each county, instead of them having to figure out, well, how do we find volunteers for our program, they could use GivePulse. It's free and available. And then they could distribute it to any nonprofit that they want in their county, who can then manage their own volunteer network. And so it's a beautiful thing if it ever could take off to the level it needs to go. But yeah, this is a testimonial from Elise, and she found great use. And this is one of the things we're chatting with regard to that service learning process that Sharon set up. And this is our website for additional information about our CCPH team and what we do here. Oops, that's the last program. So yeah, any other thoughts or questions?
Again, any questions, feel free to unmute or throw it in the chat. I do have a quick question about distribution. So especially you were talking about like local departments picking up the Walk with Ease program. I was just wondering how those who are interested, individuals or departments, how do they get a hold of the program plans if they want to implement that in their communities?
Yeah, I mean, they could just email Walk with Ease at IA State and we'll set them up or start chatting with them. So we are happy to take other communities that want to operate a Walk with Ease program. So we will formally have ISU extension and outreach involved to start spreading it to other counties naturally. So Deb Sellers is our Dean of Extension in our college, and she's passionate about working with older adults, and we're in the process of training county extension leaders across the state to be Walk with Ease ambassadors or to share that out on their own. But if a agency finds out about Walk with Ease and they want to do it, then they could, you know, jump on board on their own.
Well, thanks, Gregor. Any other questions? I have a couple more, but I want to, there we go. Well, Keely said companies interested can also email Wellness Works to get started in the worksite version. Thank you, Keely.
Yeah, we should have put your slides up here for Wellness Works, Keely, but we have a robust worksite version that is also really taking shape, and Keely's leading that implementation right now.
Well, I have a question. This one's from Sharon. So going back to just U-turn as a whole, what's the benefit for local public health who are participating in U-turn, and what are the challenges for participants, like staff time, anything else?
Yeah, I mean, we through our U-turn model, it's mainly a research network, but we created CCPH, this Community Connections for Public Health, sort of as an easier entry for community agencies to opt in. So it's more about the community partnership than about the research at that point. But we view them both being kind of part of the same puzzle. So we need the community connections to do the translational research we want to do. So I think we have ways for community partners to onboard into CCPH and just express an interest in having a connection. So there's actually efforts to standardize how a county health agency can formalize a partnership with a research institution. And they just call them academic health partnerships. And so there's ways that a county can affiliate with a research institution. It doesn't have to be ISU, it could be UNI, Iowa, any research institution where we're training students in public health. And so there's models of how to do that.
Thanks, Greg. Lena, I see you have your hand up. You have a question?
Yeah, hi, Greg. Thanks for the presentation. I'm curious to know, so many of us are trying to reach communities that we don't typically engage with, that are not, like their first ring circle, if you want to say, but need to be part of the conversation, need to be at the, not just at the table, but we need to learn from and bring more into public health conversations to make sure that we're representing the public health is truly representative of all the needs across Iowa. So I'm just wondering what kind of response you've seen or the impact of these tools to reach audiences that are harder to reach with our kind of traditional outreach methods.
Mm-hmm. Yeah, it's a good question. So again, I think I'd rely on the people in the trenches, to be helping more of that. As a university person, I don't have the same connections maybe to those partnerships that others do. So I do have experience in doing this locally, but just not at a state level. But one example in Walk with These that we're going to use is, rather than relying on clinical referrals directly, we're going to go out into the communities to do fall screens in small towns or in housing developments and things, and do free fall prevention screens where a lot of the people might not even have a doctor, they might not have health insurance, they might not know they have risks. And if we can get them to participate in a fall screen, then maybe they would get referred into the program and get treatment before they have a fall. And so we are trying to work on the upstream approach of trying to identify individuals that might have a higher risk of falling by going to them, doing community-based fall prevention screens that then refer into our programs.
Any other questions? Well, I'll throw you another one then. Speaking of smaller communities, what might be some challenges of implementing these programs in smaller communities as opposed to larger ones?
Yeah, I think capacity probably. And so one of our goals in training community partners to be able to do that is to build capacity in those systems. So one of the advantages of Walk with These at this level is that you don't have to deliver it in person. An individual can, if they have a computer, they can log in and do the virtual program on their own and have a health coach walk them through that, walk pun intended, to help them go through the program. So I think that avoids the problem of having to have a person in place. So one of the elements of Walk with These that works really well is just direct referrals. So just sharing that opportunity with people in different communities would help more people sign up. And so that's why I wanted the chance to share it here, is we need referrals from across the state. So if any people on the call, or if there's ways to get people to know about the program, then those people can sign up and provide, they can get access to the program that they otherwise might not have available in their small town or in a rural population.
Thank you. Follow-up question to that, I suppose. What kind of time commitment is expected for local public health getting involved in U-turn, Walk with These, or anything like that?
Oh, none whatsoever. So we've envisioned that, again, I guess if people are interested in learning more, at one point during, again, pre-COVID, we had a lot of things running, and we haven't really operationalized some of the same programs, but we had a series of engaged scholar talks. And so one of our visions was to have community researchers do joint presentations with community partners on campus, because we often speak different languages. And so we wanted to have, instead of the researchers talking to the researchers and the public health people talking to each other, or community people talking to each other, we tried to bridge that gap and have talks that would be interesting and engaging for both about how the partnership worked. And so we're planning to resume those. Again, it was a COVID led to some of that getting shut down, and we haven't relaunched our Engaged Scholar Talks, but they were really successful at one point because it highlighted all the different examples of community partnerships, not just in my area of kinesiology or health, but in engineering or in ecology. So for example, we had people doing citizen science work out in the field testing water quality, and that was in a partnership with researchers that were interested in studying ecosystems. And so there's many examples of partnerships at the community level that are in broad areas of health, not just in personal health, but in the health of the environment. So I guess if people are interested in, getting connected, they could reach out to uturn@iastate.edu, and I see those emails as well. Happy to answer any other questions that people have.
Deborah asked, could these programs potentially be listed or claimed on findhelp.org? So that when someone is searching for free or low cost programs in their zip code area, the program would pop up?
Yep, that's exactly where we're going. And so the vision I shared even before, maybe I'll even pull that slide up of how that would work. Oops. So yeah, that's sort of the vision of this original depiction here, that anyone can put programs into the hub. So again, the reason our U-turn team have spent so much effort working through the hub is because the hub provides that system where none of us can do that on our own, but the hub provides a unifying framework. And so I was giving examples of Walk with Ease, but any other program could say, I'd like to make my program available through the hub. And using Find Help or Unite Us, those are tools that Trina's working with, and we're actually working on the formal agreements of how those would be linked together. We've just helped build the translational elements of the hub, but Trina's the one that kind of manages it on a day-to-day basis.
Any other questions? Maybe while we're waiting for questions, and as we close out here in a little bit, yeah, I was gonna say pull up contact sheet email so that people can contact you.
Sure.
If there's any other questions, feel free to unmute, throw it in the chat. I'm gonna put an evaluation link in the chat for today's Launch and Learn. So participants, if you take just a few minutes, head to that link and fill out our participation or our evaluation. That would be great. Here's that link. Any other questions? Throw them in the chat, unmute. If not, we'll wrap up here soon. No need to stick around.
Everyone gets extra minutes in their day.
Yeah.
So yeah, I tried to keep it short to have more questions, and I could have obviously gone on longer. I'm usually not the short-winded type, so today I kind of finished quickly. I guess I'm really excited about where the Iowa Public Health Association is going, and the leadership by your team, and the engagement that exists in Iowa. And I think we're a unique state in that regard, that some states are too large or too encumbered with things. And I think we can do really tremendous things in Iowa because we're small enough that we can connect, and small enough that we can manage these programs. So I'm really excited about the possibility of having a major impact through this type of collaboration. So appreciate all the work that IPHA does and the chance to share with everyone here today.
And thank you, Greg. And if anybody likes some more details from that long-winded version, I suppose you could email him and get that then. Otherwise, if there's any other questions, feel free to interrupt me, but I think we'll go ahead and wrap up here. Thanks, Greg, for sharing your expertise with us today and talking to us about these programs. And thanks to all of you who came and spent your lunchtime with us. Next month, I think it'll be on the 17th, or November Lunch and Learn. We'll be joined by Lexi Hack, who will tell us, I don't know if I'm saying her last name right, but she'll be joining us from Health and Human Services Department and talking to us about the Stop HIV Iowa program. We're always looking for potential topics for future lunch and learns. We're scheduled through the rest of the fall and most of spring, but I think we have an opening, and if not, we definitely do next year. So contact me or anybody from IPHA. My email is brett@iowapha.org, and we can try and plan it out. Just a quick reminder, as a nonprofit organization, IPHA relies on membership dues and sustaining donors to help support our mission. If you're not already a member, please consider joining IPHA. If we have any students here, I don't know if we do, but if we have any students, check with the department chair. Some programs can help fund student memberships. If you are a member, we thank you. We appreciate any donation that fits within your budget. You can join and give at iowapha.org. This recording and all others can be found on our YouTube channel. And with that, thank you again. Thanks, Greg.
Yep, my pleasure.
Thanks, everybody who came.
everyone. Bye.
Have a good day, everybody.
Yep.